Sticks and stones may break your bones, but I can fix them for you. Hi, I'm Dr. Alan Cheung. I'm a British orthopaedic surgeon and I'm the founder of the International Orthopedic Clinic. I specialise in sports injuries and robotic joint replacement. Well, I started training in Brazilian jiu-jitsu, so I have an interest in martial arts. And a friend of mine is an amateur martial arts champion. He basically told me that some boxing organisations were looking for a ringside doctor, so I went along, and for about a year I covered a lot of the local amateur events in Singapore. But I actually realised that it's quite an unregulated industry in Singapore, and I was delighted when one championship invited me to become their medical lead in Singapore. For one championship, that involves pre-medical screening for injuries, hydration tests so athletes don't cut weight excessively and harm themselves before the fight, and then careful sort of supervision while they're fighting in the ring, and evacuation of injured athletes out of the ring, and then post-fight evaluation and sending to hospital if necessary. And each sport has its own code and particular requirements requiring head injury and how athletes are treated around the event itself. At IOC we deal with all sorts of sports injuries, and as a sportsman myself, I train in mixed martial arts that involve MMA. I know what it takes to recover and get back to sports competition. 20 years ago, a joint replacement would involve a massive cut and you may be in hospital for 2 weeks. Whereas nowadays, you may use minimally invasive surgery, which you combine with robotics, and often the patient can leave hospital the same day or even the next day. In Singapore, I'm one of the few orthopedic surgeons trained in the United States to perform robotic surgery using a system called the Makoplasty. And this involves creating a preoperative virtual map of the joint to be replaced. Usually it's the hip or the knee, and during the surgery I pinpoint the areas of the joint to that virtual map, which allows the robot to know where it is in space and operate accordingly. But what's even better about this system is that I can use the technology to plan within a millimetre or tenth of a degree of where I want to put my implants. Also, the technology uses something called a haptic system, which involves touch, a bit like the touchscreen technology we have in our phones, which prevents the surgeon from going outside the pre-planned areas, so it's very hard for them to make a mistake. But I always say to my patients that the important thing is actually the skill of the surgeon in using the technology to be able to pre-plan accordingly and get the best result for them using that technology. The important thing is that if you've had a sports injury or you have a worn out joint, then not to ignore that and sit in it, but seek help because the technology is there and available. At the moment, there are a limited number of machines in Singapore because it's a new and quite expensive technology, but as I think the cost of machines comes down and the public become more educated about robotic surgery and demand it, then it'll become quite widespread and commonplace, and doing surgery without a robot will be a thing of the past.